All right, good afternoon, everybody. Welcome to the Springtime April DSD updates. So glad you're all here. I am Emily Miller. I'm a Regional Resource Specialist here in the Disabilities Division, and I work specifically in Southeast Minnesota. So glad to be with you all today. I hope if anybody was caught in the scary weather yesterday that you fared okay. I sit in Austin, Minnesota, and looking out my office window, we have pretty blue skies right now. So that is great. Spring is here. What is it? April showers bring May flowers. So that is what I'm hoping for. Just to open up a little bit with some funnies. All right, my son told me this. Mom, what kind of shoes do frogs wear in the springtime? Open-toed. And one of my personal favorites is my spring clothes must have missed me because they hugged me so tight I couldn't breathe. All right, enough of that. Well, welcome everybody. It is April. We are here for our second DSD quarterly updates in 2025. So everyone, as you've joined today, you have been muted. All right, now to ask a question today, please use that Q&A panel on the right side of your screen. We're going to address questions as they come. However, if we don't have a response, please submit your questions on that DSD contact form, and we'll have that link today in the presentation. All right, this session is being recorded. The PowerPoint and the recording will be available on the DSD training archive page after today's session ends. So being it's the end of the month, it should be there before the end of this week. All right, you'll see our agenda on the screen. So during today's session, we welcome a guest from our waiver policy and compliance team who will be doing an overview of the newly publicized customized living setting list. And then followed by that, we have a guest from our employment VRS team who will be sharing some updates. Then we'll move into reviewing any DHS announcements, upcoming training sessions and webinars, and then we'll review resources from this past quarter. So please note that information shared during today's session is current as of today. So we encourage anyone to sign up for e-list announcements so that you can be made aware of any changes in the timeliest manner possible. All right, I'd love to welcome Maggie Munson today from our waiver policy and compliance team to review the customized living settings list. Hi, Maggie.
Emily, thank you very much. Good afternoon, everyone. As Emily said, my name is Maggie, and I'm on the DSD waiver policy and compliance team. And one of the services that I work with is customized living. And so we're going to chat about that a little bit today. So as any of you guys that work in the customized living area know, it's kind of a complicated service. There's a lot of moving parts and a lot of different things that the case manager needs to verify prior to being able to authorize services. And sometimes a lot of that information was found in different places. And so it could be cumbersome to be able to find everything and do everything in a timely manner. So we were trying to identify ways that we could help simplify the process a little bit. And so what we're doing is a full customized living list. And so this is a list that's available in the CBSM, and it includes all settings that have an active MDH license. So they're active with their assisted living license with MDH, and they are also enrolled with us for customized living. So if you don't see a setting on the list, that means that one of those two items is most likely not updated or not current. Like I said, it's available in the CBSM. And what it's going to do is it's going to identify all the different limitations that apply to this setting. There's a number of different CL limitations that exist based on when the setting enrolled to deliver customized living. And so I'll show you the list here in a second, but basically it's going to give a yes or a no for every single setting, whether or not they need to follow that, that limitation. And as I said, this is a tool that can be used to identify if the setting's eligible to serve an individual. I want to emphasize that it's just a tool. We do our best to keep it updated and have it accurate, but there are over 2,000 customized living settings across the state, and many of them may make updates with enrollment, they may make updates with MDH, and so things change. And so what we want you to do is just use it as a tool, use it as a starting point to say, okay, this is where I want to move the person into. Let me see if it's even an option right now based on the limitations, and then take that information that you have to then contact the provider and verify it. But again, this is kind of a starting place for you. So you at least have a general idea of all the things that you need to take into consideration prior to authorizing services. We published it for the first time last month, and there was just an update a few days ago on the 23rd. And through June, we will be updating it on a monthly basis, just because it's new and we want to make sure that if there's anything that's wrong, we can fix it and update it quickly. Following that, we will be updating it on a quarterly basis. So you should be able to see any updates once a quarter throughout the year. So what I'm going to do now is I'm going to steal sharing from Chad, and I'm going to share the list. So hopefully everyone can see that. I can't see the chat anymore. Emily, can you just let me know if they can see if you can see the list?
Yes, you can see the list.
Okay, wonderful. All right, so actually, I jumped ahead of myself. Let me share the page first. Okay, stop sharing and let me share the correct one first. Let me see here. Okay, here we go. This is what I wanted to share first. So this is the website where the list exists. Again, this is in the CBSM. If any of you had used the list that listed out all settings that were limited to people 55 and older, this essentially replaces that. If you go to that page, you'll then be redirected over to this one. So that 55 plus list is gone. This is the list that you'll use now. Most of the information that's in these few paragraphs here is what I've just talked about. I do just want to note here in this third section, if you have questions about it, or if there's information that seems inconsistent or that's confusing you, please send a message via the DSD contact form. Those questions will come to me and I can help you troubleshoot whatever information there might be an issue with. So this section right here kind of explains all the different information that's available in the list. So if you look down the side here, we identify if the setting is licensed as a campus, and that's a thing by MDH. There's certain setups that statute requires be enrolled as a campus as opposed to a single site setting. And so we'll let you know if it's a campus. Then we'll identify the bed capacity, so you know how many beds are there. Then we'll let you know if it's co-located or not, meaning that there are two settings that are next to each other that are owned by the same and owned and operated by the same provider. So these three columns are basically just kind of like general info. And then we come down to the different limitations that are going to be on there. So we have the limitation related to it being next to an institution, the limitation on it being co-located, the size limitation, the age limitation, and the CL moratorium. And so if you look here, it's going to tell you, so if we look at location, limitation, institution, it tells you when it applies. So this limitation applies to all settings that were developed May 1, 2001 and after. It's going to tell you what yes and no mean. Yes, the setting must follow the identified limitation. No, the identified limitation does not apply to the setting. So that's how the entire list is going to look. It's going to have general information, and then it's going to have yes and no's in all the different columns. One thing that I do want to note, and I have an example down here. So just because a column may say yes, doesn't necessarily mean that it has an operational effect on the setting. It just means that that is a limitation that applies based on its enrollment date. So the example that we have down here is ABC Home was enrolled to provide CL services on January 1, 2018, which makes it subject to the location limitation, which again, we have that up here as an institution. As a result, it cannot be located on the grounds of institution. In the list, provider ABC Home would be marked with a yes because that is an active limitation, but it doesn't have any operational effect. So it says it's important to note that yes does not imply the setting is located on institutional grounds, but rather that the setting must follow the location restriction. So hopefully that makes sense. Yes means they fall within the time period that this is an active limitation, but it doesn't necessarily mean that they're quote unquote like out of compliance with it. So that's why the list is a tool giving you the information you need to start, but you still want to verify information with the providers. All right, so now let's jump into the actual list. All right. So unlike we had for the 55 plus list, or if you're familiar with the ICS settings list, those ones are just embedded within the page itself. However, because this one is so long, we decided to have it linked as a Excel spreadsheet, and it's at the bottom of that page that we just looked at. So once you pull it up, you can't edit it, but you can filter. So there's filters on here. So as I said before, we have some just general information about the settings. So the name, the address, where it's located, if it's licensed as a campus, its bed capacity, and whether or not it's co-located, if that's something that you need to pay attention to. So that's the first half of the list, just the straight information. Then the next half is going to identify the yes and no's for all the different setting limitations. So institution, are they located on the grounds or next to an institution? This is a limitation they would need to follow. Yes doesn't mean that they are, it just means that you need to verify that they're good on that. The co-location limitation, is this something they need to follow? This is when two settings are next to each other or adjacent and run by the same provider. So the difference between these two, the first one has to do with, are they on the property or adjacent to an institution? This one is, are they adjacent or on the property next to another setting run by the same provider? And then we have the size limitation, the age limitation, and the CL moratorium limitation. And I won't get into what the specifics of these are, but those, if you want an explanation on those, that all exists within the customized living page in the CBSM. And then again, it's just going to tell you yes and no's. So let's say, for example, you have an individual who's under the age of 55 that needs to find a setting. You could come on here and you would want to exclude all of the settings that are subject to the age limitation, right? Because the current age limitation says this setting, setting ABC Home, can only serve people 55 and older. So if it has a yes in this column, automatically you can't use those locations. So I would just, I don't know why it says campus in there. It should not, but just filter that out. And now you have a list of all the settings that could potentially serve that individual. So that's kind of how the list works. Hopefully it's fairly user-friendly. If you guys have questions about it, or again, if some of the information doesn't look correct or you have questions, please let us know. There are some things on here that you might be like, wait a second, why does it say yes for this? Or why does it say no? And that's because there's, again, customized living is complicated and there's a lot of kind of intricacies and reasons thing might be a yes or no. They're few and far between, but just know that if you do have a question, again, feel free to reach out for clarification. All right, so that is customized living. And then Chad, if you want to bring up the next slide. There we go. So the next thing that I just wanted to give a shout out to is a training that's coming up soon. On May 21st, we're going to be doing a training on integrated community supports. About a month ago, we did one on customized living that tried to be, they call it an all-encompassing training. It was for case managers, providers, any other external stakeholders, and we went over kind of everything that a customized living provider would need to know. And now we're doing the same thing for integrated community support. So we're going to talk about what an ICS setting is, how the HCBS rule fits into it, how authorizations work, how service delivery works, all of those different pieces, because we know that it is a little bit of a different type of service than people are used to. We're used to kind of those two ends of the spectrum of either it's residential or its own home. And this one kind of sits in the middle. And so there are some kind of nuances to it. And so we'll take some time to go over that and answer any questions that you guys might have related to it. So there was an e-list that went out back on April 22nd. You can see it linked there at the bottom of the slide. So if you would like to register, you can just give that link a check. I'm not sure if any questions have come in, but if they are, I will just go through and answer them in the chat for you guys.
Thanks, Maggie. I see one question here. It says, when I attempt to filter or sort, it gives me an error saying it's protected.
Oh, that is good to know. I will mention that to our TTC team and let them know that that there's an issue with that, because we do want it to be able to be filtered for you guys. So thank you for letting me know that. And then I think the other one was, can you throw a link to it in the chat? Do you mean a link to the CL list or to the webinar for ICS? The ICS registration. Okay, yep, I will throw a link to that in the chat. And I think,
all right.
I think that was all, yeah.
Okay. Maggie, thank you. I don't see any other questions at this time, so I believe we can move on to our next speaker. All right, we are going to now have some guests from our Employment First team to go over changes with employment services and VRS. Hi, guys, welcome.
Hi, everyone. Let me get everything. There you are. Welcome. Yeah, we're here to talk about the VR closures and then how to authorize EDS find. And to get started.
Okay.
My name is Cole Sorensen. I am a young white person with short dark hair and glasses, and I'm using a communication device. I work as DE1MN coordinator at DHS.
Great. I'm Christy Howe. I'm the Employment First lead. I am a middle-aged white woman with dark brown and gray hair and a blue sweater. I work kind of to further our Employment First policy within DSD. I also work with VR and our E1MN team. And Beth Gruby isn't here today, but she's our benefits planning coordinator. And so we're here to talk about kind of the situation with VR and EDS find, and to provide some grounding for people who are new. This slide is showing the sequencing of services for adults, employment services, the engage, plan, find, keep. And this is really kind of clarifying who pays for what service. So the waiver pays for employment exploration, employment development. We go to VR for find stage and then back to the waiver for keep. And this is all based on our federal guidance. So we'll be looking at the find section today specifically. So a lot of what we'll talk about is just recap of what's happened recently. There hasn't been a lot of new information in the last few weeks. But what happened was back in February on the 4th, VR hosted a VR and Community Partners Forum where they shared that they have some significant budget challenges coming up. They're having to move to a priority of service. And then they posted a Q&A on March 4th that kind of dug into some more questions. And then on March 27th, they sent out a message saying they were going to have to close categories 2 through 4 on April 7th. And they may need to close category 1 in the future. So that is kind of still a possibility that they may need to close category 1. And for those who haven't been around, this happens from time to time where VR has to close categories. So it's not unheard of. The link here will bring you to both the recording of the forum, a PowerPoint, and the Q&A, and then that message from March 27th. So you can go take a look. So there's a lot of notes about, well, this one is kind of just a summary of what does this mean for the people that we work with when the category is closed. So as they explained, this applies to anyone who applies after April 7th. So if someone's applied for VR services before that, they will not be placed on a wait list. They'll be able to receive the services they need. For people who apply after the 7th, if they're in a closed category, they'll be put on a wait list maintained by VRS. When VRS staffing become available, they'll be removed in order of application date and category. This applies to all VRS services except necessary pre-ets. And as a note, 83% of all services are to people in category 1, and most people with waivers are in category 1. So this shouldn't have a large impact on the majority of people we serve right now, even that they haven't closed category 1. So all of this talk about categories, this is what they are. VRS's federal guidance kind of defines what these categories are. Category 1 is people with the most significant disabilities, people with 3 or more functional limitations. There are 10 areas that they look at, and I could not tell you off the top of my head what they are, but it's out there if you're interested. So category 2 is people with 2 or more functional limitations. Category 3 is 1, and category 4 is everyone else. So one of the questions that we've gotten is like, what's the process that we need to follow at this point? And we do need to follow that standard guidance that's listed on the hub regarding applying to VR. So people need to submit that application. VR will determine if they're eligible and what category they're in. If they're in category 1, it's business as usual, do the standard intake process. If they're in categories 2 through 4, VR will send them a letter saying that they're in a closed category and will be placed on a waitlist maintained by VRS. That letter will be mailed or emailed to the person depending on their preference. And they can also ask VR to add it to their MyVault account and share with the rest of their team. And then, so if someone is in categories 2 through 4 and they're put on the wait list, and they have a waiver, they can use EDS Find. There's 2 times when EDS Find can be authorized. The CBSM guidance has 3 listed. That'll be updated in the next week or so. So functionally, there's 2. It's when VRS or SSB, if they're ineligible or not a cert priority status. So they're not eligible for VR services, or they don't meet that open priority of service category. And they're placed on a wait list maintained by VRS and SSB. And I want to make a note about that wait list that's maintained by VRS. That's different than a wait list that a provider may have because they don't have capacity at that point. That's not a reason that we can use waiver find. It's only if categories are closed and the person's not in an open category or they're ineligible, or for the second reason, the services are exhausted. In that case, they would also get a closure letter from VR saying that they can no longer benefit from that service. So those are the two reasons. So how to authorize EDS find? Case managers need to indicate one of the reasons on the note section of the service authorization, either that they're ineligible or not priority of service or service exhausted. And then they do also need to keep a copy of that closed priority category letter that the person receives. So it'll be important to work with the person or the rest of their team to get and keep a copy of that letter. So once you have all of that in place, it's just following that standard authorization process. We can go to the next slide. Send out the authorization, start job searching. EDS find covers the first 30 days after hire, and then it's off to the employment support services for the rest of ongoing supports. And here is all the different things that I referenced, the link to VR News, where you can find all of their communications. We sent out some guidance earlier this month. And then we are linking to the CBSM employment development and the guidance for service authorization. And then if you have any questions that we haven't addressed, you can send them through the EUNMN request form. And that is all that I have. Any questions that have come in? All right. Well, if you do have any.
Oh, I apologize. I just wanted to let you know I'm not seeing any questions in the chat at this time.
Yeah, okay, great. If any come up, feel free to reach out and do keep an eye out on the e-list. We should have that guidance page updated in the next week and a half or so. All right, thanks everyone.
Great. Thank you. Appreciate both of you attending today. All right. Well, we are going to move on to the DHS announcements. All right. So this is our Aging and Disability Weekly Updates. So DHS distributes a weekly e-list on Tuesdays that contain all announcements for the work week. Now, occasionally we will need to send out e-lists outside of the weekly announcement about timely matters, and so those might include emergencies or disasters, critical systems messages, critical incidents, or messages that are geared towards a very specific audience. So lead agency staff can subscribe on either the AASD or the DSD e-list CBSM page. All right. DHS requests public comments on CADI waiver applications. So DHS is requesting comments on proposed policy changes for the CADI waiver application before DHS submits it to CMS for approval. So as part of the 5-year renewal process to continue the CADI waiver program, DHS will submit the application to CMS with an effective date of October 1st, 2025. To view the CADI waiver application and submit comments, visit the full announcement via that April 16th e-list, which is linked in the bottom of the screen. The comment period will end on Friday, May 16th at 4 p.m. The MMIS exception code 635 for transitional services. So DHS is fixing an MMIS programming issue for the exception code 635 that's related to transitional service line items for the 4 disability waivers. Until DHS fixes the issue, the limit before January 1st rate increase applies to all service start dates. Lead agencies must track the affected service agreements and update the transitional service lines with the increased amounts as needed after DHS fixes the MMIS programming issue. So we will send out an e-list announcement when the issue has been resolved. Oops, sorry. Residential Support Service Criteria, or RSSC. So effective July 1st of this year, DHS will implement the new Residential Support Services criteria as required under Minnesota statute. So now this change will require people to meet criteria to access community residential services, or CRS, and customized living services. This change also reserves access to CRS and customized living for people who have complex behavioral health needs or complex medical needs. The RSSC criteria. So the Residential Support Services criteria applies to people on the BI, CAC, CADI, and DD waivers who receive CRS service authorizations after July 1st of 2025. And people on the BI and CADI waivers who receive customized living, which includes the 24-hour customized living service authorizations after July 1st of 2025. People on the BI, CAC, CADI, and DD waivers are exempt from meeting RSSC criteria if they have an active service authorization for CRS or customized living on July 1st of 2025. Now, RSSC does not apply to people on EW or AC waivers. DHS is updating the training materials and the policy manuals to provide guidance, and we will provide more information in those future e-list announcements. Lead agency instructions to avoid gaps in services for people that will be transitioning from CFSS from PCA and CSG. So DHS created instructions that lead agencies must follow to avoid gaps in services for people who need additional time to complete their transition from PCA, CSG to CFSS. So lead agencies can enter 6 additional months of PCA or CSG services for a person who already has had a 6-month PCA CSG service agreement for an assessment that was conducted on or after October 1st of 2024 if the person meets at least one of the following criteria. The person's service agreement will end in 2 months or less, or the lead agency determines the person is likely to require more time to complete the transition from PCA CSG to CFSS due to unique circumstances. For detailed instructions, the lead agencies can refer to the link on this slide. MnChoice's initial assessment validity extension. So effective July 1st of this year, MnChoice's initial assessments will be valid for up to 365 days from the initial assessment interview date to establish program eligibility. A new assessment type called Initial Assessment Review will be available in MnChoice's and MMIS. The new assessment type is a remote activity that lead agencies use after an initial assessment when the person has a delay in opening to a waiver, CFSS, AC, or ECS. Eligibility updates will no longer be available in the MinChoices application. This policy only applies to people with MinChoice initial assessments that are completed on or after July 1st of 2025. DHS is updating training materials and policy manuals to provide this guidance, and there will be more information provided via e-list announcements before July 1st of this year. Moving Home Minnesota services, rate increases and changes. So effective January 1st of this year, select Moving Home Minnesota service rates were increased to align with community standards and program needs. The e-list that was published on January 14th of this year provides information on the services that were affected and the corresponding increase or change. The Moving Home Minnesota demonstration and supplemental services table has also been updated to reflect all the changes. If you have questions about the information on the e-list or Moving Home Minnesota in general, please email the team at the Moving Home Minnesota email address on this slide. Waiver-funded assistance for community emergencies or disasters. So DHS may approve lead agencies to authorize the use of respite services or residential services during a community emergency or disaster for people who receive home and community-based services. To request information on how to access waiver-funded assistance for emergencies or disasters for people accessing services through the disability waivers, please utilize the DSD contact form. For the elderly waiver or alternative care waivers, please email the DHS AASD HCBS email. All right, and we'll move on to training announcements. I'll invite my coworker Jody to kind of go from here. Hi, Jody.
Hi, Emily. Thank you so much. Hello, everyone. My name is Jody Lewis. I'm a member of the Regional Resource Specialist team as well here at Disability Services Division. And now we'll talk about some upcoming trainings. DSD updates, they've been scheduled for 2025 and they're available now to register on WebEx. This is a change from previous years and the registration link is included in this slide. DHS is holding quarterly webinars for people who are interested in the Disability Waiver Rate System, or DWRS. All 2025 sessions have been scheduled and you are able to register on WebEx. The next session is June 11th. DHS and Minnesota Networking and Education and Assistive Technology are hosting a webinar on sensory equipment and its essential role in supporting people with a range of disabilities and neurodiverse conditions. During this webinar, participants will learn about why sensory equipment is so valuable, how sensory equipment can help people feel safe, balanced, and confident in their daily lives, how things like weighted items, fidgets, vibration supports, trampolines, and other tools can improve people's ability to function, how to think about, evaluate, and approve sensory equipment and assessments while always focusing on what works best for the person, and also about useful tips and ideas that they can use right away. The webinar will take place on May 22nd from 10 a.m. to 11:30 a.m. and you can find the registration link on the April 29th e-list or also on this PowerPoint when it is uploaded to our DSD training archive page. The DHS Licensing and Disability Services Divisions will host a virtual roundtable on April 30th that is about supporting people to have meaningful outcomes. Participants will have the opportunity to share their experiences, ask questions, identify opportunities to partner with each other, review 245D requirements and strategies to meet them, and also to provide ideas about best practices and positive supports. On the slide, there is the registration link. The 2025 Odyssey webinar series will include webinars that address the challenges and opportunities of aging and disability services by bringing possibilities to life. There's no cost to attend the webinars in this series. The next session is titled Aging with HIV/AIDS and will be on Thursday, September 18th. We will share more details and registration information for the webinars in the coming months. DHS and the University of Minnesota's Institute on Community Integration are pleased to announce that the first annual Great Minnesota Regional Positive Support Get-Together is scheduled. This will be held on June 23rd in St. Paul. Attendees can connect, learn, and grow with others who use positive supports, network with agencies, counties, and regional networks, learn from local and national experts, and we will send an e-list announcement to share session information and registration details soon. DHS is hosting a 3-day Culture of Safety online advanced training in early May for 245D licensed providers and lead agencies. This online training will cover how to use safety science principles to respond to critical incidents, how to engage employees in safety and improvement efforts, and also how to analyze systemic factors related to unintended outcomes. This training will provide tips and information to help organizations better understand why work does not always happen as expected. The training does not cover best practices to directly reduce incidents and increase safety when organizations serve people. For more information, refer to the DHS Culture of Safety Critical Incident Review link that is on the slide. You can also register using the link that is on this slide. Aging and Adult Services would like to highlight that there are 3 new trainings related to the elderly waiver that are available. 2 of these are Elderly Waiver Foundational trainings, which cover administration, financial eligibility, assessment support planning, and rates. The 3rd training focuses on remote adult day services. On this slide, there are other available DSD training resources. The DSD Training News and Information site lists current and upcoming training opportunities that focus on the state and federal programs that are administered by DHS. The DSD Training Archives includes archived webinars. There's also the MinChoices training page, which lists webinars and trainings that are related to the MinChoices assessment and support plan applications. The training opportunities for case managers and care coordinators page contains a list of recommended on-demand trainings that are available for case managers and care coordinators. The next section will provide you with resources that will be helpful to you and the people that you support. Community First Services and Supports, or CFSS, launched on October 1st, 2024. Listed on the next 3 slides are the current CFSS resources that are available for lead agencies. This slide contains links to information that is related to CFSS authorization and MMIS. We encourage you to review all the available resources to familiarize yourself with the program and its requirements. People who use PCA and CSG, their families, and other interested parties can learn more about CFSS by watching the videos that are located under the Training tab of the DHS CFSS website. In addition, the Disability Hub is another resource that's available to people interested in learning more about CFSS. DHS will share more tools for people who receive services as they become available. This slide includes additional CFSS resources. We encourage you to review all of the available resources to familiarize yourself with the program and its requirements. To stay up to date on information related to CFSS implementation, please be sure that you are signed up for our DSD e-lists. On this slide, there are some of our foundational resources for communication and policy references for DHS. When you have policy questions that are related to your work, we recommend you access the resources that are listed on this slide. If you're still unable to find an answer to your question, then use the DSD contact form. Please remember to double check your name and contact information before submitting to receive a response. To reach the RRS team for technical assistance, or if you have additional questions about the information that was contained in this presentation, please submit them using the DSD contact form. Thank you all for joining us today, and have a great day.